and welcome. This is Dr. Peter Nixick, resident at the University of Wisconsin, Division of Plastic and Reconstructive Surgery. On behalf of the Poor Lab, I would like to thank you for watching our supplemental video on end-to-end microvascular anastomoses using the two-stay technique, performed by Dr. Weifeng Zhang. This video will cover Lesson 4 of the Microsurgical Training Manual, end-to-end femoral artery anastomosis using the two-stay technique. The two-stay technique is used when there is enough length both on the pedicle and the recipient vessels, so that the double opposing Acklin clamp can be flipped 180 degrees to expose the back wall. This is considered the simplest method of end-to-end microanastomoses. For this reason, we attempt to control all surgical variables in a clinical scenario to allow for use of this technique. The first step is trimming the adventitia from the free ends of the vessels. We recommend only stripping the adventitia that hangs into the lumen of the vessel, as overzealous adventitial stripping can result in vessel wall damage. The first stitch is thrown in the surgeon's forehand at the 180 degree position furthest from the surgeon. Use both the needle and the forceps to manipulate the vessel to ensure that this stitch is exactly in the 180 degree position. Place your forceps within the lumen of the vessel and open them just wide enough for the needle to pass through, providing adequate counter tension to take your bite. Remove the needle atraumatically, either with your forceps or with your needle driver. Then, manipulating the vessel by the adventitia with your forceps or with the needle, find the 180 degree position on the other vessel. Remove the needle atraumatically and pull the suture through. Align the suture tail within the axis of pull so as not to cheese wire the vessel. Now tie your first knot only using a surgeon's knot if there is tension on the anastomosis. The second stitch is thrown at the 180 degree position nearest to the surgeon in the surgeon's forehand. Similar technique is employed placing the forceps within the lumen of the vessel and manipulating the vessel by the adventitia with your forceps. With the two-stay sutures complete, it is time to move on to the front wall. This can be done in either an interrupted or running fashion. We would recommend that for beginners, an interrupted technique is used, placing a stitch within the middle of the front wall first, and then bisecting at distance for a total of 3 front wall sutures. The interrupted technique offers the best chance of perfectly equal suture placement. However, the running technique is more efficient and decreases risk for backwalling. In this video, we use the running suture technique with 3 running sutures thrown in the surgeon's forehand. With all 3 stitches thrown, the knots are then tied sequentially. When the final knot is tied and trimmed, this completes the front wall of the anastomosis. Using the double opposing Acklin clamps, the vessel is then flipped 180 degrees to expose the back wall. This would now be a good time to examine the front wall of your anastomosis from the inside to ensure that you did not back wall. And now the back wall of the anastomosis is completed using the running suture technique, identical to the front wall. When the anastomosis is complete, the double opposing Acklin clamps are removed and methylene blue dyed saline is ran through the anastomosis to examine for leaks and patency. This concludes Lesson 4 of the Microsurgical Training Manual, two-stay method, end-to-end microanastomosis. Thank you.